This episode is for you if you've had shoulder pain in the past or you continue to have shoulder pain, and every time you get back to exercise or get back into your sport and you feel like you're good and then you go back to activity and it flares back up. Well, the reason is you're not getting to that underlying, that root cause reason, and that's what we're gonna help with today. Welcome back to the channel, guys. My name is Dr. Joe Ruskowski, owner and physical therapist here at Identity Physical Therapy in Livingston, New Jersey. Today we have a special episode for you. What we're going to be talking about today is shoulder pain and understanding why it exists in the first place, especially from a mechanical perspective, guys, right? I'm a physical therapist. I'm all about movement. I'm all about understanding the root cause and addressing issues. I'm avoiding injections, pills, surgeries, all those things. We want to know, well, why does it happen in the first place and what can I do about it? That's what our episode is going to be about today regarding shoulder pain. So what we're going to be doing today is going to be looking at the overhead reach, and what we're going to go through is break down every part of that overhead movement and explain what's actually happening, what is required from a biomechanical aspect, and then if you're having any limitations while doing that overhead reach, where you're having the limitation will tell us exactly what we need to address. So what does IDPT do so differently in regards to shoulder pain that traditional PT and other rehab solutions just fail to address? Well, it's actually not necessarily in our assessment process, but it's actually what we do with the findings of that assessment and how we go about treating it. And what we do that's so different is we place a huge emphasis on the rib cage. The rib cage is the foundation of what the shoulder sits on top of. And so we can go ahead and try to build a big, great house like we would trying to rehab a shoulder, but if that house is sitting on sand, then it's just going to sink down. We need to first understand the foundation that it's sitting on and then move on to the shoulder. So what I wanted to do is use our skeleton model so you can actually get a good understanding of what we're looking at. So if I spin them around and we're looking from the back side, you can see that the shoulder blades literally rest right on the rib cage. And the shoulder blade, called the scapula, is actually the socket of the shoulder joint. And so when we address the rib cage, we quite literally are directly influencing where the shoulder joint is positioned. And so as we're assessing the overhead reach and we're looking at someone's range of motion, here's what we're actually looking at, especially with IDPT's philosophy, is so as we come overhead, the beginning third of that movement, we're looking at the ability of this shoulder blade to just start to rotate upward. And in order to do that, we need this space to be cleared so that this can start to rotate that way. And so what we're looking at is, do we have any restriction in the posterior backside, posterior lower of the rib cage as we get to this? And if we can go through this range of motion clear, no problem, then we know that we don't have restriction here. As we get to about that middle third range, we're now looking at kind of the middle of the upper back. So kind of like the rhomboids. I'm sure you've heard that muscle before, right? So any tightness or restriction here, okay? And then as we go to that last third of going all the way overhead, we're looking at, can we create space and lengthening in this upper back area? So literally the shoulder blade is going to start here. It's going to start coming up like this a bit. And then as we continue to go overhead, this shoulder blade is rotating up the rib cage. And then about the last 10 degrees of getting that last bit of overhead, the top of the shoulder blade here actually needs to tip back just slightly. And so we'll know if we can get to like 90% overhead, but not that last piece, we know that we're just a little bit restricted all the way at the top here. Now there is one bonus area that we're looking at, and because the rib cage does wrap all the way around, we are also going to be looking at the front of the rib cage, so right in your chest and your pec area, even into the sternum here. The reason we need to look at this is because if we have so much tightness and restriction in the front of our rib cage, what that's going to do is actually squeeze our ribs down, and see how that's going to roll my shoulders forward. It's also going to give us a forward head posture. So that's if you see someone walking around like this, they have a lot of compression pulling that rib cage down. And so everything that I mentioned about the back side of the ribs is essentially going to become irrelevant if this is being squeezed down first. Now on the flip side, right, we don't want to have our whole front of our rib cage compressed down, but then what people will typically say, or even people think this is considered good posture, is to be here on the flip side. The reason we don't want this is because you can see that if I have this good military posture, that squeezes my shoulder blades together. What that's going to do is prevent movement at my shoulder blades. So yes, I compress down and then I go overhead or I go out to the side, but now the shoulder blade can't move the way that I just described that it's designed to move. And so what it does is leaves your shoulder out on an island to do all the work by itself. Typically, when someone has shoulder impingement or some type of rotator cuff strain, a lot of times what they do is they focus on strengthening this area around here, but that's not what we want to do, because if we do, we're further restricting the shoulder blade and making the shoulder work harder and harder. So here's a test that you could do at home by yourself to see where you're having your restriction and then what we can do to start improving that. So what you're going to do is get pretty close to the wall, and you're going to be close enough that you can put your forearms flat on the wall, but I don't want you to be pinched here or like really rounded here. What you're going to do is push your chest a little bit away from the wall so that your shoulder blades get formed to your upper back. You're going to keep that, and from here you're going to slowly, as slow as possible, keep pushing into the wall as you slide your hands and arms up. I don't want you to lose any contact with your forearm and the wall at any point. Once you feel tightness in your shoulder, like right now I feel some tightness right here, or you feel any restriction anywhere in your shoulder, the test is over. Another way that the test is over is if you're going overhead and your hands start to get closer to each other with your elbows kicking out. The other way that it's going to be over is if as you're going overhead, you start to feel yourself shrugging up and you feel tension in your upper traps. Lastly, if you start to arch and push your chest up and forward, no good. So I'm going to show you one more time. So I'm going to get elbows flush on the wall. I'm not going to be here. I'm going to punch my chest a little bit away. I actually can feel my heel still on the ground. That's important. And then we're going to start to slowly slide overhead as we continue to push into the wall. And once I feel a ton of muscle work in my shoulders, maybe a little pinch, I know right about there. And what I want to do is now look at this angle from my shoulder to my elbow and my hand. And I want to determine, well, am I in the bottom third of the motion? Am I in the middle third or the upper third? For me, I'm right about in that middle third. So like we said earlier in the video, that's going to mean that I'm clear in that lower posterior rib cage, but that I'm already starting to have restriction around my rhomboids in the middle of my shoulder blades and higher. So after you do that assessment on yourself, what I want to do is go ahead and give you 3 different exercises. Each exercise is designed to improve each part of that limitation that we mentioned. And then I'll throw in one bonus exercise for those who self-identify when you look in the mirror that you feel like your shoulders are rounded and that your sternum gets depressed forward. So the first exercise that we're going to do is actually going to be a breathing exercise to help reposition the rib cage. The reason that this works is, watch, as I take a deep breath in, you can see everything rise up. What happens is the rib cage actually opens up. And then as I take a long breath out, the rib cage actually closes down. So we can use that breathing and put our body in a certain position to influence the rib cage to open up in certain areas and to close down in others. So this first exercise is going to be aimed to actually open up the lower posterior aspect of the rib cage, which is going to give us back that early overhead range of motion. So what you're going to do is you're going to lie on the ground with your feet up on a box or a chair or even the couch. And you're going to try to put the bottoms of your feet together as your knees go out to the side. Now, I shouldn't feel any tension in my hips or my legs at all. And if I do, just don't have your feet touch. What you're then going to do is reach your hands out towards your knees with your palms up towards the ceiling. Let your low back slowly go down to the ground softly. And then you're going to take a deep but silent breath in through your nose and then take a full breath out through your mouth. You're going to repeat this for about 2 to 3 sets of 10 breaths. So this next exercise is going to be a dumbbell hold. This is a great exercise because, again, everything that I'm emphasizing is an at-home way to help really improve your shoulder mobility and decrease your shoulder pain. So what this reach is going to do is actually aim to elongate the muscles around the mid part of the shoulder blade, so those rhomboids. So what you're going to be doing is lying on your back again with your feet back up on the box, a bench, a chair, or even a couch. You're going to take this weight, press it straight up to the ceiling. Now, I don't want your shoulder blade to rest on the ground. I actually want you to punch your shoulder blade up off the ground. And then I like to hold this for about a minute to a minute and a half, typically 3 to 4 sets. When I breathe in, I'm trying to breathe into that rhomboid area. The one thing I would say is you don't want to overreach and try to punch this quite as far as you can. All you want to do is punch just enough to get it off of the ground. Now that we've cleared up the low reach and even into the second, third, we need to clear up that last bit of overhead range of motion. So what I like to do is use a nice thin band here. I'm going to step my feet into it and then hook it to the back of my knees. From here, I'm going to cross the band so that I grab both parts of it. And then I'm going to lay flat. So the first thing I'm going to do is make sure that my low back is flat to the ground and I kind of tuck my pelvis underneath me. Then I'm going to take this band with my elbows straight the whole time and start slowly reaching overhead. Now, once I feel any restriction in my hips or my ribs start to pop up, I've gone too far. So again, I'm going to take this band, start reaching overhead as far as I can without those mentioned compensations. And once I'm there, I'm going to hold this right here, and I'm going to take the same breathing that I've been doing. So in through my nose. And I'm going to go for about 3 sets of 6 breaths. And you should feel that air go into your ribcage. So last one for that bonus exercise. So if your front of your rib cage is so compressed down that it's rounding you, what we want to do is be able to elevate that sternum and open up the front side of the ribs. Now to do that, like I mentioned earlier, we don't want to just arch everything open. We want to do it methodically, but keeping the theme of using things that you can do at your house, we're going to use a box again. You're going to lay back on your back, just like we did on that very first exercise. So we're going to let our knees go wide. And we're going to try to get the bottoms of our feet to touch each other. The difference is going to be with the arms. So instead of reaching here, we're actually going to reach behind our head like we're just relaxing. And then our elbows are going to slightly punch up toward the ceiling. From there, we're going to do the same breathing, and you're quite literally going to feel that breath go into the front of your chest. So to summarize, there are the 3 major areas plus the 1 bonus area when we're talking about getting mobility back in our overhead shoulder mobility. First, we need to clear the posterior lower, then the middle back, and then the upper back around the upper trap area. That bonus area is all the front side of the rib cage, the chest, the sternum. Once we use breathing drills and techniques to help clear that area and create space in our body, we then need to train it. That's when we're going to use rotation-based presses and rows in order to actually get rotation back in our rib cage. And then we need to actually hone in on the spot that was limited. So that might look like some type of overhead pull down, overhead press, or even some type of horizontal push or horizontal row. Once we do those things and we continue to train the right way, you'll be back and better in no time. So as always, guys, if you found this information helpful, please like, share, and subscribe so we can continue to bring this knowledge to you guys. Thanks. I'll see you in the next episode.